Hi guys, I am Dr. Priyanka Mehta, obstetrician, gynecologist from Diva Women's Center, Chennai. Today in this video, I am going to be talking to you about partner support during labor. So it is so important that because labor is sometimes a long and very demanding process, that you have a plan for who is going to be your birth partner. This plan should be made in advance of your birth, so that either your mom, your friend, or the best partner would be your spouse, who is there to support you and who is there to give you all the encouragement, and who has also probably attended the birth classes with you, so they are in tune with what you want and how you want to be treated during labor. So if we divide the support that they can provide during the pre-labor phase, that is when you are either at home or you're on the way to your hospital when you have started the labor contractions. So that would be a good idea, whereby let us talk about how your partner can help you at different phases of time. So in the pre-labor phase, where you start getting some mild pains, it is not very strong contractions, but there is some kind of a discomfort or some feeling of a backache, and you're not very sure whether you're in labor. So partners at this point of time can either distract the mamas and make them, either they can give them some rest, give them a massage, or give them something nice to eat, take them for a walk, so that if it is just a false labor pain, it will go away. But if the contractions are increasing in number, or they're increasing in the number of times they are happening or how strong they are, you will be ready to reach to the hospital. Once you reach your hospital and you have been told that you are in early labor, again sometimes this can last for a little longer than we expect it to be. Say for a first time pregnancy, the early labor could be as long as 10 to 12 hours, and even sometimes longer if you have been induced. And for second pregnancy also, it can sometimes go to 6 to 8 to even 12 hours. So in the early labor phase, when they are having these pains or the contractions are increasing, birth partners actually can they can revise with the moms how they have learned about breathing during labor, just sync with her, get to understand how she's feeling, make her move around rather than just being lying on the bed, encourage her to take more fluids and more liquids, because you need to keep yourself hydrated during labor, so you should not be starving, especially in the early labor. Once the contractions are increasing in either the number of contractions in 10 minutes, usually we say that in 10 minutes you will be having 3 to 4 contractions, and each will last for 40 seconds or even up to a minute. So if you start getting these contractions, say you start getting 2 or 3 in 10 minutes, so you can start timing these contractions. You can go through the different kind of breathing techniques that you have learned. Say the de-stressor breath, where you are breathing in and then breathing out. So practice with mom how she has to breathe, so that she doesn't panic. Sometimes moms can just start panicking, so again bring her back to where she was, because you are the person who is with her, and you are the person who is going to be encouraging her throughout the process of labor. Because sometimes they feel that it is going to last for a very, very long time, and I may not be able to cope, or the pain is getting too much. So when they start feeling like in the active phase of labor, when they are more than 4 or 6 centimeters dilated, at that point of time, if the pain is becoming more to for them to bear, they may start asking for different pain relief options. And sometimes they even say that I cannot tolerate the pain, so please do a cesarean for me. So this point of time, birth partners actually can really support them, give them some kind of a massage in their legs, back, neck, or even head, and already pain relief options would have been discussed with you. So you can go through those options, whether it is just the nitrous oxide gas, or some kind of injections are available which can really give some pain relief for some time, or you want to take up an epidural. So all that will be discussed with the labor team, and when you are there with her, supporting her, she feels more confident of the situation. Also, a little later, as the pains are either increasing, and sometimes she just says that I just can't do it. So when the mothers feel that now they just can't make it, it is impossible, and they are just ready to give up, that's the time all the more partners have to, either you can bring in your soothing birth oils or play some music of a choice, or if she just wants to be left alone, just be there for her and tell her that she can do it. Sometimes they don't want to answer questions, sometimes they may just get angry or irritated at you, sometimes they may just not want you to ask any questions. So just tune in with her, try to understand, try to just support her. You can just give her a hug if she's okay with that, or just a leg massage, anything that you know her better, and you can definitely understand at that point of time what she wants. So she doesn't want to talk at all, just hold her hand and be there. Just keep telling her she can do it. The next phase of labor after the active phase is the transition phase, whereby the dilatation is almost 9 to 10 centimeters, and that is when they will actually, sometimes they will feel like passing motion also, sometimes they will pass it also, because the baby's head is actually coming down and the baby's head is pushing down, and that can cause it. So sometimes women in labor, they may feel embarrassed about it, so just tell her that it's okay. It happens for many women, in spite of they can sometimes just poop during the labor, so it's okay, and just encourage them at that point of time. Then comes the pushing phase, and that is when again you have to remind her about the different breathing techniques. She may just feel very hungry or thirsty at this point of time, so offer her a drink. You can wipe her forehead if it is sweating. Sometimes even you will just not know what to do, so at this point of time you can just hold her strongly, and just keep telling her that yes, it is possible. And you can sometimes even see the baby's head crowning down, so just tell her that it will be over soon and you will be meeting your baby soon. And these words really make a lot of difference to moms, and they feel encouraged. And sometimes just knowing that somebody is there supporting them, someone who is strong, someone who is going to be there to look after her, and that gives her a lot of confidence. So don't be afraid yourself. Make sure that you also are, you have eaten your food and you are not hungry, and you are also not very tired. So try to get a good sleep, and sometimes just not saying anything also helps. So be along there for your partner, and happy birthing, and thank you so much for watching this video.